is Nadia, and today I'm going to be showing you how to reconstitute a medication and give it via mini bag. So first I like to start by washing my hands. Next, what you're going to want to do is compare your physician's orders with your MAR to make sure that they're the same. So I'm checking for correct dose, 450 milligrams, the correct drug, Zithromax, correct route, IV, the time, 9 o'clock, still on my time, so I'm good, and the correct patient, Pablo Pitts. I'm also noting right now that my patient has an allergy to strawberries, so I'm just going to want to make sure that my medication doesn't have anything to do with strawberries, like strawberry extracts. So now that my physician's order and my MAR are the same, I can put my physician's order away. Next, you're going to want to go to your Pyxis and grab out your medication. I've already done that. So here I have Zithromax, and you're going to want to do your first medication check with your vial. So Zithromax, correct dose, 450 milligrams. This has 500 milligrams, so I know that that's adequate enough to meet my needs. Route is IV, and this is for reconstitution, so I know that's correct. And the time is 9 o'clock, so that's correct. And for my correct patient, Pablo Pitts, so that's okay. Now what you would want to do is grab your monograph, and this is going to show you how to reconstitute your powder medication. So here, for a 500 milligram vial, I'm going to need 4.8 milliliters of sterile water for injection. So I need sterile water, which I have here, and I only need 4.8 milliliters, and here I have 10. Oh, this one? Here I have 10, so I know that that's adequate for that. But I feel like that's a little low, so I'm just going to grab another sterile water that's full. Okay, so next, after that, I'll have a final concentration or volume of 5 milliliters, and according to my calculation, since I only need 450 milligrams, I'm going to need 4.5 milliliters of this reconstituted vial. But I'll start with reconstitution. So first, what you want to do is get your syringe out and attach the blunt tip needle and a few alcohol swabs. Okay, so you want to start by just swabbing the tops of your vials for 30 seconds, and you're going to allow them to dry. So 30 seconds and allow it to dry, 30 seconds, allow it to dry, and then wash my hands one more time before I start with the medication. At this point, I'm going to pull back 4.8 milliliters of air, and I'm going to want to inject that into my sterile water. And at that point, it will let the syringe fill with fluid all the way to 4.8. I have no air bubbles, so that's ready to put into my powder medication for reconstitution. But before I do that, I want to check once more that I have the correct medication. So I go back to my MAR, Zithromax, 500 milligrams for my 450 milligram need, IV, the time is still correct, and for my correct patient. So now I can add my solution. You want to let the air flow back out so you don't create like a vacuum in your medication. So once that's done, you want to just recap your needle because you're going to maintain asepsis. So, and now you can reconstitute. So just gently roll the vial between your hands until the powder medication is all reconstituted. So now that's good. So I'm going to go back to my monograph and see what I need to do after this. So I can dilute my medication in either 250 milliliters or 500 milliliters of D5W, normal saline, or dextrose and saline. I'm going to choose normal saline because it's compatible with my drug, I know that. And I'm going to choose 250 mLs because it's the lowest amount, and I know that my patient is in fluid overload, and I just want to give the shortest or the smallest amount to make sure I don't exacerbate the issue. So you're going to need another alcohol swab, and you're going to want to swab the port of the mini bag. And put this down and make sure it doesn't touch anything. So now I need according to my calculations, I need 4.5 mLs of my medication. So 4.5 mLs of air into my reconstituted medication. Invert my vial and let it flow out to 4.5. I have an air bubble here, so I'm just going to go a little bit past. Up to 4.5. Okay, so that's good. Since my port has been swabbed, I can now inject my reconstituted medication into my mini bag. So now you're done with your needle, so you can just cap that and put it into the nearest sharps container, and then also dispose of any garbage near you. Okay, so just mix your medication in your mini bag. Don't do it vigorously, you don't want to create bubbles. So at this point, you can now label your bag, which I've already created the label, so just your medication, the dose, the volume, and your initials and the date. And put that on the bag as to not occlude any information that's actually on the bag. Okay, so you're ready to go to bedside now. You're going to need something to wash your hands, alcohol swab, and your secondary lining, as well as your MAR. And you're ready to go to your bed. So when you first get in, you want to do a safety check, as well as introduce yourself to the patient. Hi, my name is Nadia. I'm your student nurse for today. I see here that he has some things in the bed, so that's not safe. I'm going to take them out and throw them in the garbage. I hope that didn't have strawberries in it because he's allergic and that was a juice box. So now I just want to make sure I have the correct patient here. Okay, Pablo Pitts. And as well, I'm going to be checking the line for any infiltration or phlebitis. Now, I'm going to do my final medication check at the bed. So Pablo Pitts, date of birth, Zithromax, 450 milligrams for IV, and the correct time, which is 9 o'clock, which is right now. So that was my final medication check. At this time, I also want to educate the patient. So, hi, Mr. Pitts. I'm just here to give you your Zithromax for your respiratory infection. The side effects of this drug are diarrhea. You could get allergic reaction symptoms, so hives and itchiness of skin, and as well as nausea and vomiting. So, do you have any questions before I start? Would you like to infuse the medication? Okay, so I didn't have any objections, so I'm allowed to put this in. I'm going to want to start by just hanging my mini bag there. Okay. At this point, you just want to, okay, before I even start, I'm going to wash my hands one more time because I've entered the patient's room and I want to make sure, I don't know what I've touched on the way here, so just want to make sure everything is okay. So now I'm going to take out my secondary lining here. Okay. So you get this blue situation, and that's for lowering your primary bag. So I'll put that on first before I forget. And then I'm going to spike my secondary bag. Okay.
I'm also going to note on my MR that I think he has no...
And now your alcohol swabs come in handy because whoop, and that's nothing happened there. So you just want to ensure that your roller caps are closed on both your primary and secondary line. Okay, and you're going to swab the injection port before the Baxter pump. And you just want to stop actually the flow of your primary line. Swab that as well. Now you just want to let them dry. Swab for 30 seconds, let them dry, and you can attach them now. And finally, you just want to back prime your secondary tubing. So make sure your line is close there and lower your bag. And you're just waiting for the drip chamber to fill halfway to 3/4 way, and that's done as well. So you can hang that. And now you just want to set your pump rate. So I know that I have a volume here of 254.5 mLs. And my monograph said I can only infuse this over an hour, so I'm just going to put that in. Okay, so that's going to infuse, and then you want to also just make sure everything is unclamped so it can flow naturally. Okay, and at this time you just want to document, and I'd write down how my patient tolerated it, and also document any adverse effects that may happen, and and make sure that it's dripping correctly in the chamber so everything's flowing nicely. And that's it.